Yeah, good evening all and welcome. I am Sundeep Akula from NATCO team. You are listening to another special episode of Respire, a lung cancer awareness initiative, one voice at a time. It's a joint initiative by NATCO and Voice of Healthcare team. And as you know, the Respire, nothing but the raising awareness to fight against the lung cancer. You all know lung cancer is the most common and remains one of the leading cause of the cancer-related deaths. And in lung cancer, there are a lot of misconceptions and myths, and also the gaps to understand. So, so that's the reason it falls under the shadow of focus and expertise. So today we have our expert, Dr. Darshit Shah from Reliance Foundation Hospital, a renowned medical oncologist, hematologist. Over to you, sir. Hi, to show some light on the vital aspects of lung cancer and make us understand what
Hello.
is it is. Hi, sir. Good evening.
Hi, good evening. So, first of all, I would like to thank Voice of Health and NATCO for this initiative. The more we create awareness, the more we are reaching towards, early diagnosis, early detection, and in fact, early treatment, which results and translates into the better overall survival. Lung cancer was a disease, it was presumed that it is predominantly in smokers, which is not there now. People who have never smoked a cigarette in their lives are also suffering with lung cancer in equal amount, and I would say they are more in numbers because of the there are so many factors, environmental factors, and the dietary, the lifestyles, everything is changing. So it is incidence is increasing. It's one of the leading cause of death in India as well as worldwide.
Okay, sir. Anyways, you are talking about this smokers and non-smokers. So when we talk about this non-smokers, it's really becoming more common, sir, in non-smokers.
Yes, we are seeing, lung cancer. I mean, so many patients we are seeing who are never smokers, or I would say reformed smokers, the people who have quit smoking maybe 10 years or 15 years ago. So they are also in a very high number. Females who have never had a cigarette in their life or weed in their life, they are also diagnosed with lung cancers. So yes, smoking is one of the risk factor, but it's not the only risk factor. It's like we have other reasons also.
Okay. And what are the other risk factors, sir, other than smoking? When we talk.
Predominantly, it's the environmental air pollution. Predominant the when people are staying near the industries and everything. All these things. The environmental pollution is also one of the major causes. There are so many cancer patients who just come to us to tell me what is the reason, which we also don't know. You know, so
Yes,
yes.
understood. So when you see smokers versus non-smokers, what could be the percentage of smokers, sir? Because
So
I
when we talk
know.
about yeah. So let me go into the depth of lung cancer. Lung cancer for I mean more masses in lung cancer for us it is like divided into three types. One is adenocarcinoma. There's something called small cell carcinoma. Something called squamous cell carcinoma. So usually small cell and squamous cell are predominantly in the smokers, and they account for I would say around 20-30% of the patients, but I would say around 60 to 70% of the patients are adenocarcinoma. Amongst adenocarcinoma patients, we have equal proportion of smokers and non-smokers, I would say.
Okay, sir. And anyways, you have raised the point in the starting of your when you were talking, sir. When you talk about detection, early detection, this is the key point. So why is early detection is very crucial in lung cancer awareness?
Very, very crucial. So let me tell you, during the COVID era, in 2020, when I was in Tata Memorial Hospital and we were, everyone was, I mean, almost all of us was either diagnosed or, having some member in family having COVID. So in those times, we used to get CT scans for all our patients. In those times, we were able to detect lung cancer very early.
Oh,
Like, lung cancer is usually detected in later stage. People usually have symptoms when they are advanced stages, like, stage 3 or stage 4. Stage 1 lung cancer is hardly having heavy symptoms, it's very difficult to diagnose in early stage. So predominantly the people who are heavy smokers, like people who have 30 pack years of smoking and above, should be undergoing an yearly low dose CT scan to identify if there are any suspicious nodules. If there are suspicious nodules which are maybe suspicion of cancer or malignancy, we should get a biopsy done as soon as possible.
Okay. I think you are the person who has came across many cases, sir, when you're practicing in Tata. So the tier one, tier two patients, you are traveling from other parts and other interior areas. So yearly, these diagnostic tools are meant to say accessible to that patient, sir. Low dose CT and other.
Yes. So, there is not a, like, if you ask me about breast cancer, there is a very specific guidelines of every woman more than 40 years doing mammography. The smokers is predominantly, it is not the guideline which has been incorporated into Indian guidelines. But in US, there was a trial which showed that people who are very heavy smokers, if they undergo screening, there is chance of early detection. Tier 1 and Tier 2 cities forget about screening. I would like to educate them, each one of them, to reach to your doctor in case of symptoms. If you are having prolonged cough, prolonged weight loss, cough, blood in sputum, so many patients. I'm not lying. So many patients from Tier 1 or Tier 2 cities are taking tuberculosis treatment because if the patient in India, tuberculosis is also very, very common. So the patient is not diagnosed, then we just presume that it is tuberculosis. They have been treated with tuberculosis for 4 months, 5 months, 6 months with no improvement of symptoms. I would say worsening of symptoms, and then they reach out to us. So the awareness part is very important. I would say, if your symptom is unexplained, if we are not reaching to a diagnosis, please reach out to your doctor. If your doctor is unable to diagnose, please, reach out to a specialist or a super specialist. But there has to be a diagnosis. This is my take home message. This is my request to all the viewers from Tier 1, Tier 2, or Tier 3 cities who are, online.
So, you talked about prolonged cough and blood in sputum, sir. These both are very common. I mean to say, these two symptoms should not be never be ignored with the.
So, I would say not. And let's forget about lung cancer. Any symptom which is a prolonged one,
Mm,
if
yeah.
your routine is changed, we should not be
Mm,
ignoring it. Not every lung cancer patient has cough or blood in sputum. Okay,
mm,
if the patient is having back pain, prolonged back pain, it may be a sign of a disease which is just spread to bones, which is causing him or her back pain. So any symptom which is prolonged, which should be taken very seriously.
okay. Back pain also, sir. Linked. Okay.
Yes,
Prolonged back pain
any.
also linked. Okay. Okay.
Prolonged back pain can not be always related to cancer,
Oh, it's one of
but
the. I understood, sir. One of.
basically, one of the like so every symptom can mimic cancer basically, but there are thousands and ten of different diseases which can also be there.
Okay. So anyway, sir, you just put on some light on the treatment and also the innovations from last decade. What are the changes and what are the evolution happened?
Sure.
Yeah.
Sure. So the lung cancer treatment has, changed drastically. Gone are those days when chemotherapy used to be the only treatment. We are moving towards a precision oncology. We are moving towards more and more of precise therapy, targeted therapies, immunotherapies. So, when a patient is diagnosed with a lung cancer, we usually, a stage 4 lung cancer, usually we try to get an NGS testing done, which identifies any changes in the DNA or RNA level, which are called mutation. Depending on those mutations, we have different kinds of targeted therapies. They are predominant in the form of tablets only, and those tablets are highly efficacious. very well tolerated, having significantly improved results, and they are the like the game changers when we talk about lung cancer management. Similarly, I would like to talk about immunotherapy. Immunotherapy is also like if the patient is having NGS report negative, if the patient is not having targetable mutation, we can definitely offer them chemotherapy and immunotherapy. So this is the advancement. We are moving away from chemotherapy. We are moving towards more towards targeted therapy, precision oncology, and we are more wiser now, I would say.
Okay, sir. For our audience, can you simplify what is exactly the targeted therapy?
Correct. So very good question. Targeted therapy, usually what we do is like chemotherapy is basically a drug which kills all the cells, cancer cells, as well as it may have some impact on normal cells. Regarding targeted therapy, the cancer cells do proliferate with a specific mechanism. There are specific mutations, and what is mutation is basically the change in the DNA or the RNA level. So the cancer cells which are proliferating because of a specific mechanism, target therapy identifies that, it cuts the cancer cells proliferation, it acts very precisely, and that's why it's very, very efficacious. It's very efficacious with having minimal side effects because it's very precise. So this is the new advancement.
Hmm. And immunotherapy is also related to target therapy. Any difference is there, sir?
Correct. So immunotherapy, I would say, like body's immune system is more or less reactivated. There is something called PD-1. There's something called PDL-1. It's also one of the mechanism to stop the proliferation of cancer cells. PD-1 inhibitors are there, PDL-1 inhibitors are there. I'll not go into the depths of immunotherapy drugs, but this is one of the mechanism of stopping the proliferation of cancer cells.
Okay. And anyways, you talked about different types of lung cancer in the starting of your talk, sir. So you will be having a personalized treatment plans for each type of lung cancer, sir, designed.
Definitely, definitely. As treatment now to everyone, we are individualizing treatment for each and every patient. For the people, it's lung cancer. For us, lung cancer is like a Pandora's box. We have to intervene at so much for each and every patient, and this is how we treat every patient. It's always an individualized plan.
Okay. And coming to the accessibility and affordability of this type of medicine, sir. So what are the major barriers for quality cancer care in India? You personally saw.
Yes. So basically, that's a very good point regarding accessibility, regarding the cost. Till date, we are struggling because the medications, the targeted therapy, some of the immunotherapies, they are quite expensive, and out of the reach for majority of the population. Uh, I know the people are getting more and more insurance done. They are also getting support from the government, but still it's out of reach for so many people. There was a paper, there was an oral presentation from Tata Memorial Hospital, my alma mater, in the ESCO, where it was shown that only 4% of the patients in India are affording immunotherapy out of all 100 eligible patients. So the number is quite low, all thanks to the high prices. If it is made more affordable, I'm sure the conversion ratio will be increased. More and more patients will be benefited.
And anyways, the targeted therapies nowadays, a lot of generics players are also there in India. So this targeted therapy is
Yes,
also the
yes,
same thing, affordability when it comes to.
yes. So as correctly pointed, like generic players are also there. So that's why thanking from bottom of my heart that the cost of these medicines have decreased, and we definitely want more and more generics to come in and to help people, and so that the cost is very low. More and more people are getting benefit with the therapy and not deprived of treatment, basically life saving treatment.
Uh, anyway, sir, in starting of your our talk, you have given some strong message to tier one, tier two cities regarding signs and symptoms. If I talk about treatment also, what advice you give you to the patient coming from tier one and tier two cities on treatments, treatment plan?
So yes, so now with in 2025, I would say tier two cities are also moving very fast, keeping up the pace, uh, more aware, more educated, the doctors, the local practitioners, as well as the people. So, but when they come to us in Mumbai, we usually, I as a medical oncologist, we make a protocol, we plan the therapies, we guide the patient, and whomsoever local oncologist or are there, we basically be the anchor in Mumbai, and the local oncologist just treats the patients. That's how we operate.
Yes. And you have enlightened us on treatment, signs and symptoms. Then coming to the apart from this whatever the scientific aspects, when you come out social impact or mental support, what kind of mental support these patients may get, sir? Because cancer is not about one entire family is threatened by listening this word,
So,
single word cancer. So how does you manage those kind of patients?
so let me tell you about mental. Yeah, so let me tell you, it's not about mental support of the patient. It's about
Mhm.
more about mental support of the family.
Yes,
Family
exactly.
is struggling with the patient's health. Family is struggling with all the logistics. Family has to struggle so many things. They are not capable of talking their struggles to the patient, but a caregiver is it's very much at pain. So we also do caregiver burden score, and it's usually high for majority of the patients. So patients also have so many. From we talk about patients, they also are struggling. I mean, there are thousand things which are going in their mind about life, about treatments, about future prognosis. So yes, it's difficult. Counseling is difficult, but it's very important that patients have built. We develop a trust. It's a trust-based society. Patients and doctors have trust on each other, and that's how we just our only enemy is cancer. So we just fight against them.
Okay. So there will be a vital role of caregivers in this to manage this. Okay, so
100%.
and yeah, okay, so and coming to this, let us talk about this most misconceptions or myths. What you heard of from your patients, myths or
Okay.
misconceptions.
So myths are, okay, let me tell you. The most common myth is sugar खाने से कैंसर बढ़ता है.
Yeah.
There is one of the myth. It is not true. It has not been backed by any evidence. All my patients, I would say 80% of patients, they come with some heard or seen, or some of the relatives must have told them sugar खाएंगे तो cancer. They just cut down the sugars. It's always good to cut down sugars for your health, but there is no scientific evidence. The second myth I would
Okay.
say is biopsy करने से कैंसर बढ़ जाएगा. So it is also not a concept anymore. Biopsy is only for diagnosis. Doing a biopsy doesn't spread cancer. So these are two myths which we usually encounter for our patients.
And sir, a particular patient which is with high risk, let us take metastasis or fourth stage of the cancer, and what kind of advice you give, because he was, for example, this patient is reluctant to go undergo screening. So what is your advice to that particular patient?
If a patient is not undergoing screening, I mean, we cannot force them.
Okay.
Okay, but if
Even
a
though he's at high
patient
risk.
is suspicious of cancer,
Hmm.
yeah, high risk, but we always can educate them, can always tell them about the pros and cons of screening, but I don't think we can just force someone for screening. But yes, when a patient is diagnosed with cancer, there are so many people who are not taking treatment. They are scared. I mean, somebody XYZ person would come and just say that chemo is fatal. I want to tell each one of them that chemotherapy is not fatal. Cancer is fatal. We should always be scared of cancer. We should not be scared of chemotherapy. Yes, chemotherapy has some side effects, but believe me, around 80 to 85% patients, they are managed with when we give chemotherapy, we always are competent enough to manage side effects. But cancer, if not treated, it kills. So please take treatment. That's my also one of the take home messages.
Okay, sir.
They go for some kind of easy options, like somebody would say like just take this churn, and some of people would go to that, and they have, I mean, let me not mince my words, they have lost their lives. The window of treatment is very important. We have to start the treatment very early and at appropriate time.
Yeah. Sir, if I want to tell, because I'm seeing you from last couple of years or 3 years, so you came across many type of patients in Tata also, because they are into different sector of the patients, different kinds of patients. But because in Tata, separate precision oncology you were talking about, as a precision medical oncologist, what give you the hope to treat lung cancer, sir, as per your experience?
So lung cancer is the only cancer which has got the highest number of mutations. The target we have, the targeted therapy has evolved around lung cancer, because lung cancer is predominantly a genetic. There is some kind of mutations which we usually found, and there has not been any other cancer in which these kind of mutations and this kind of targeted therapies are available. It all starts with lung. So the precision oncology has always evolved around targeted therapies and immunotherapies, and now more precisely the antibody drug conjugates. We are moving towards CAR T therapies. So the oncology is moving very rapidly. So this is how we are trying to cope up with the advancement. So we are just following the latest cutting edge technologies.
Yeah. Thank you, sir, for concluding the talk. Just once again, I'll ask one strong message or strong advice. You already given a couple of messages. One powerful message for the audience.
I would say stop smoking. I would say be healthy, exercise more, focus on weight loss, eat healthy, consume less of junk food. That's all. Try to keep yourself healthy. That's the take home message.
Thank you, sir. Thank you.
Okay.
Thank you. Thank you very much, sir.
Thank you so much.
We'll meet in another platform with one more awareness program, sir. Thank you very much. Yeah, Sandesh, you can.
Thank you.